Welcome back, everyone, to the Smile Reconstruction Podcast. I'm your host, Dr. Tanner Townsend, along with my fabulous co-host, Dr. Joshua Muir.
Hey, guys.
And in this episode, we're going to be talking a little bit about the gap you don't talk about. And one of the things that I always find very interesting is that single implant patient, Dr. Muir, that either has an abrupt issue with a front tooth or has a missing tooth they've had missing for a long time. And it's just this really emotionally sore topic oftentimes, and they often avoid it. Or when we see patients that have like this tooth that like is broken or like gets shattered from like a baseball bat, or a kid hit them in the face, or a root canal is failing, and you go to the dentist and they're like, you have to get this out now. And it's like this emotional heartache that they go through, especially on that day. So one of the questions I have for you, what usually happens when someone loses that one tooth that they're attached to?
Well, the biggest thing is people have that huge emotional response. And like you said, it can last for a long time. If they've known about it, they try to put it off. But as far as, what happens on that day, typically what happens is people will come to the office and they'll be an emotional wreck because of this catastrophe that's led to their losing a front tooth. But we get them taken care of, and they do typically leave with a new tooth. Now, they may be in a temporary tooth. They may be in a transitional point during some healing, but to go from that catastrophic feeling to, okay, this wasn't as bad as I thought it would be, that's what we typically see.
Yeah. And it's truly amazing to go from broken situation to we're going to end with a tooth, which is fantastic.
I think that's one of the reasons that people put this off, is that emotional response. So, I have a patient that recently saw, this is a lower front tooth, but there's a clear fracture through the root. It's vertical. It's infected around there. There's bone loss. And the response he gave was, so I don't have to get this done right away, right? Because he just doesn't want to get it done. It's a front tooth.
Yeah.
Now, meanwhile, he's already missing some back teeth, and that really doesn't bother him as much. But when it's a front tooth, it's so visible. It's so out there. So that's why people wait.
So besides that, like the delaying the inevitable, what are some things that people that have that gap come in with, like when they're in that catastrophic mentality? Like, what are some things that you can kind of tell they're thinking through? Like, are they thinking through confidence things? Are they thinking through eating things? Are they thinking through being able to talk normally? What are you typically seeing in these patients?
Yep, this is where we stereotype patients. So, you have someone that comes from, a male patient, he's going to be worried about his eating.
Mm-hmm.
You have a female patient, she's probably going to be worried about her looks. If you have anyone who has a daughter that's getting married, or they're getting married, they're going to be worried about their looks. So those are the things they're worried about. Patients also worry about pain. But to be honest, pain typically with a missing front tooth, that's not the biggest thing.
Mm-mm.
It's life is the worry. It's not the pain side or anything else like that.
Yeah. And I think some of the hesitations that I see too, it's really not money on these cases, because they're like, this is a front tooth, I have to get this taken care of. It's does life get in the way? Or this isn't good timing, I have to leave on my trip to Cancun in a week. Or
simply go to work.
Or simply, I've got to go back to work after this.
Or talk to my son's teacher. I need a front tooth to talk to my son's teacher. Yeah.
Yeah. So those are the typical hesitations we see with the front tooth in particular, whether upper or the lower. And so, but ultimately, I feel like the beauty of being able to take someone from fear and unknown to tooth in one day is incredible. And like you said, it's a temporary solution. Oftentimes, it's not your final tooth that you're going to have on that, and it's not going to be perfect necessarily, but it's amazing and to the point where people aren't going to notice.
Yeah, that's one of my very favorite things. We get a call from a referring doctor. They say, hey, I've got a patient in the chair. They're freaking out because their front tooth broke off. Can you guys take care of them? And in most cases, we get them in that same day. We take the tooth out, we put an implant in, we put a temporary crown on the implant, we let them go, and they feel good, they look good. Emotionally, they feel so much better, and it's a success story.
Yeah. If that sounds at all familiar, come talk to us. We will get you on the schedule for a free consultation, and we will get you a solution that you can be proud of and a smile that you will not have to worry about. That is it for today's episode of the Smile Reconstructed podcast, and we will catch you on the next episode.
Thanks.